Doctors have some funny ideas about why people don't like to come to their offices. Some doctors think people are afraid of them. Some think it's because of the probing questions they ask about personal matters. None of these is the reason. People don't like to go to see the doctor because they know they're going to have to take their clothes off. In spite of all the appeal nudity has for us in certain forms, most people are fully aware that they don't look as good as they ought to naked. Most people think they look worse than most other people naked. They must have courses in medical school about how a doctor should tell the patient to take his clothes off. And each medical school recommends a different method. A few doctors just say something direct like, take your clothes off. I always figure they went to a Dominican Republic medical school. Others try to break it to you gradually. They say, strip to the waist, please. This is good news because you figure you can at least have your underpants on. But if you have any experience at all going to doctors, you know it's only temporary. There's bad news coming. Some doctors try to be discreet. They say, all right, now let's take our clothes off, shall we, and see what we have here. It sounds as though the doctor's going to take his clothes off, too. I don't know whether men doctors treat women patients any differently than they treat men or not, but I certainly have no information about how women doctors treat men patients. I doubt very much if you'd catch one of them saying, all right, now let's take our clothes off. Doctors are used to all this because they see a lot of patients. Patients aren't used to this because they only see one doctor. It has occurred to me that to be on equal footing with the patient, it might be a good idea if the doctor did remove his or her clothing to set the patient at ease. I know, though, that in real life this wouldn't work out very well. After all, doctors know just as well as anyone else that they don't look great naked. No matter how the doctor breaks the news about undressing to a patient, he better try to make it sound matter-of-fact, professional, and like an ordinary, everyday kind of thing to do. Well, taking off all your clothes in a stranger's office is not a common, ordinary kind of thing for most people to do, and there's no way for a doctor to phrase it that make it sound as if it were. Some doctors are cowards. They must have their nurses do it for them. If you'll remove your clothes, she says, Dr. Carter will be in to see you in a few minutes. If it's 10 minutes before the doctor comes, there's almost nothing for a patient to do in the interim. Doing nothing is twice as hard if you don't have any clothes on. If the doctor's license is hanging on the wall, you can read that, but if you didn't think the doctor had a license, you wouldn't have come to him in the first place. And anyway, you aren't used to reading naked. Usually a patient just stands there once he's undressed, and it can be a long stand. The patient can't sit down because the small side of the chair in the inspection room has a fake leather cover on it that is no doubt sanitary but is also cold, especially to sit on. If doctors want patients whose blood pressures don't rise to abnormally high levels when taken in their office, they've got to find a way to diagnose patients' illnesses without making them undress.